Hi, everybody. Welcome to today's webinar. I'm Lindsay Buckaloo with the TribalHub team. I'm joined today by NextGen Healthcare. While everybody is still kind of filing in, if you want to drop in that chat where you're tuning in from and what the weather is like even. I'm living vicariously through you if you are somewhere warm. Because here in Michigan, the real feel this morning was like 13 degrees. And I already put away my big coat and I am boycotting getting it back out. So just suffering in silence. Not in silence, that's fine. But especially if you're somewhere warm, let us know. I know in North Carolina, it's like 80 degrees this week. So, like I said, we are here today with NextGen Healthcare, part 1 of 3 in the webinar series that they are doing. Oh, Colorado, beautiful weather. Love to hear it, Susan. We'll begin the presentation here in a few. Just a couple things I'm going to go over quick so you have a nice little intro. Special thanks to our webinar partners today, NextGen Healthcare. Today presenting, we have Julie Labar and Mike Harris from NextGen Healthcare and Feather River Tribal Health. We are happy to have them, and I think this is going to be a great session. Couple learning objectives to take away from this webinar. Best practices for managing and leveraging population health data in tribal settings. Some tools and strategies for effective and culturally appropriate health reporting. And learn how you can flex just to address new emergent crisis around global warming issues. And that is sort of just basic overview on that. I will leave the majority of the presenting to the presenters today. Just wouldn't be doing my job if I didn't tell you guys what we've got coming up at TribalHub, which is to say it is regional season. Our first spring regional actually is next week, Monday, in Michigan, where it's going to be beautiful on Monday. So that is a lovely thing. We will be at Soaring Eagle Casino and Resort, and we are excited to be there. Yeah, that's pretty much what I got, you guys. So with that, I will turn it over to you, Mike and Julie, and we can get this started.
Good morning, good afternoon, everybody. I'm Mike Harris. I'm Chief Information Officer here at Feather River Tribal Health. Today I'm going to talk to you a little bit about some of the things that we've done here to implement population health, data reporting, and all kinds of neat stuff.
Hello, my name is Julie Labar. I am a nurse by profession and a product manager in the value-based care regulatory and reporting space here at NextGen. And so I've worked ever since I started at NextGen in the population health space with the population health application and then how it kind of correlates with our electronic medical records. So we're very happy to be partnering with Mike among other tribes and kind of paving the way for us to support tribal health.
So I guess since this is storytelling, let me tell everyone a little bit about us. We're Feather River Tribal Health. We are centrally located in Northern California in Oroville. We have 3 beautiful clinics. Our primary clinic is in Oroville, where we serve all kinds of folks. We have a wellness center right next door, and we also have a satellite clinic in Yuba City about 40 miles away. To talk to you a little bit about some of the things that we've done, I guess, sorry, you'll have to excuse me, I'm a little bit nervous today. But I think when we started with NextGen, we were always looking for something that was making it easier to report data. I know everyone in tribal health has reporting requirements, and so I think, sorry everybody. I think finding a way to easily report data is something that everyone needs to find. We moved from RPMS to NextGen, and the reporting there was a order of magnitude greater. So we found NextGen quite a bit easier to use, and I think that going to the next step, finding population health was something that was able to we were able to leverage quite a bit more functionality. I think from the aspect of, democratizing and getting the end users involved in reporting. For a long time, it was IT and QI that were the only people who could run reports. And so we found ways that we can allow the end users and getting that data into the hands of the people who need it. And some of the interesting things that we found, we've collaborated with our outreach department and started outreach to folks who haven't been seen, and we've started measures or campaigns around our quality measures. And so this was something really interesting because we had never really done reporting or outreach with, oh my goodness. Julie,
So
would you mind speaking a little bit here?
Yeah, absolutely. So when you get connected with population health, what you're looking for is not only a way to identify reporting opportunities, but also different things like taking care of care gaps, those kinds of things. And so population health really does help to streamline that perspective from the next gen EHR into the population health application. And so I know that Mike has worked really hard with his team in onboarding population health and really taking a close look at those cohorts of patients and what their risks are, what their gaps in care are. And we've worked really hard to align the GIPRA measures within population health. Many of you are probably aware of the opportunities to do reporting from a standalone utility or from an opportunity, an external source, which will provide you a report of your measure data that you can then submit to IHS or for your grant opportunities, et cetera. But what we've done within the population health application is actually built the GIPRA measures directly in the application. So they're tailored to the needs of the tribal populations. So it's those measures that are necessary to report directly up to IHS. And so when Mike and his team joined up with population health, that brings the data from the EHR. We can also bring other claims feeds and other data opportunities into Pop Health, and it presents them in a meaningful way. And so, Mike, if you want to just talk about what you've kind of done as far as wrapping your wellness team around the measures. I know you've done some gatherings and some, just kind of stepped out campaigns on a monthly basis related to what you're seeing within the application for measures.
Yeah. So the idea came to us late last year. Our wellness and outreach director had a great idea to combine traditional outreach with population health. And so on the screen here, you can see the pictures of our tabling event for our fall gathering. So each department in the organization was given a GIPRA measure. And so they were to design a table around this. And so we ended up having, I believe, 13 tables covering most of the GIPRA measures. We also started outreach using population health. And so we originally used what the outreach administrator and the profiler to create these campaigns and send it out to each of the patients who were in these cohorts. And over time, we found it very successful. There were some issues to start out. I think that over time we developed a great cadence, and we actually developed that into a monthly initiative. So now in 2025, we have monthly initiatives based on those measures. So last month was healthy relationships. And this month is cancer awareness, and so we've kind of lumped them all together. As there's only 12 months, and so we tried to coordinate with the specific initiative if there was a national event or whatnot. But we've kind of lumped those together, so making sure that we can cover everything. And so we're using population health in an interesting way in the fact that our outreach team is generating these reports and getting in contact with the patient. So not only are we having these tabling events and education when the patients come into the clinic, but we're also reaching out to them and trying to educate them based on hey, you're due for this. Let's get you scheduled for an appointment. We see you haven't been in the clinic in 2 years, and are there barriers to care? So making sure we're really engaging with those patients.
I love
Um,
the idea, Mike, with your monthly campaigns, because people do hear in the public, the communities, they celebrate, other organizations also celebrate, or discuss specific targeted things, October Breast Cancer Awareness Month, those kinds of things. And if we can align the opportunities for the care of your populations and your patients around those kinds of things, it's more messaging, the better, right? And we can wrap right around the community and helping support them in closing these gaps in care and getting them to their preventative opportunities that they need. So that's hugely beneficial.
Yeah, and I think that's one thing our organization is really keen on is wraparound care and making sure that our patients are getting everything they need. And I think this is a critical aspect um, to using that is population health and being able to utilize data in a way that is meaningful and that not just really technical people can get their hands on, but the end users, the nurses, the CHRs, the line staff have a way to get at information and use it effectively.
Yeah. Great. And I think you're going to step through some of what we refer to as modules, Mike, in your next discussion, and some of those opportunities, and everybody will get a chance to kind of see some what it looks like when you're within the application, and how the teams get to access things. So this is good.
Correct. Yeah. And so I took these from our system. I didn't want to use canned images, but we're a small clinic in Northern California. But I think what's really interesting is once you start looking at the data, you can see that your patient base is really kind of spread out. And so, even though we're centrally located, we have people, scattered throughout Northern California up to, 100 plus miles away. And so looking at this data, we were really surprised. And I think that geospatial analysis is a good way to kind of figure out for growth, especially when you're looking to expand, you're looking to include new services. You can see where your patients are actually coming from. And that's a very, very powerful tool to have in your toolbox.
Another opportunity that other folks have used the geospatial setting for is in identifying times of risk, for instance, and emergency management kind of thing. There are several areas that might have hurricane warnings, fires, wildfires, those kinds of things, and you can really know where exactly your patients are, so you can do some outreach to the most vulnerable patients. So within our application, you'll see across the top of this particular box, and it's in every page that Mike will share with you, is you can narrow it down by practice, provider, specialty, etc. And then you can drill down into these green bubbles within the zip codes, and it will actually give you a patient list of those patients that are within that green bubble or that particular mapped area. So then you can get to the real information, and you can do outreach. You can identify patients that may be higher risk related to social determinants of health, et cetera. So you can really focus on the needs of your population based on geography.
And this is one of the screens that our outreach team will be using, or is using, I should say, on a regular basis, where we can see the patients who have not been seen. So when we're trying to get those folks back into the clinic, when we're trying to make sure that we're doing a good job of taking care of our patients, that we can look at this and say, oh, hey, at a glance, we have 14% of our patients who've been seen in the last 6 months. And again, these are live screenshots from our system. You can see we still have some work to do, and that's why these measures are a priority for us, is making sure that our patients are getting back in. But and again, as Julie said, that for each of these graphics on the screen, you can click on the pie chart, you can click on the each of the percentages, and it's going to load you a list of those patients. Those patients can be exported into Excel. You can load them back into the hub and create campaigns. So it's really flexible in how you can use this data. And again, everything is at your fingertips. It's all web-based. And on the fly, you can create these reports and change these reports to see what you need. And with this one specifically, so right now we're looking at all of the patients in our organization. So we have approximately 7,000 unique individuals at our clinic. But if I wanted to here, I could pull down different conditions and look at people with hypertension or diabetes and see where they rank in being seen. So again, on the fly, super powerful tool in the hands of your line staff. And this goes a little bit more into depth about the condition registry. So here I've pulled 3 different conditions. So diabetes, tobacco use, and hypertension, creating a Venn diagram of all 3 comorbidities. And again, each one of these you can drill down on. So clicking on the intersection point of 138, so approximately 2% of our population, will create that list. And so again, being able to generate, and then from this list, you can actually create bulk orders. So if we needed to, we could add lab orders or immunizations right from the hub without having to go into each individual chart, saving our team a lot of time.
Yeah. Let me just talk a little bit about the hub now that you've mentioned that, Mike. And so when we work within the population health application, it's a cloud-based, as Mike mentioned, web-based solution. You can highlight a cohort of patients based on, you can slice and dice patients based on conditions, based on risk, based on gaps, based on metric compliance. And once you've gathered that list in that particular cohort that you want to pay attention to in a specific way, then you can export that from population health into the next gen EHR. And so then Mike's going to talk in a little bit here about how he has done some outreach with his teams from using our partner Luma to do some outreach work. But you can do that directly into the hub, as Mike mentioned, where you can do bulk orders. So if you're exporting a list of diabetics that have not had an A1C, you can export that list, bring it into the hub, we call it, and from there you can place an order for an A1C for all of those patients. Someone can then, reach out to that. You can also reach out to that patient via email, text, and say, you have something to pay attention to, so get in touch with your provider.
Yeah, and so as Julie was mentioning, when we went live with population health, we had a great experience. We had a great team for implementation, but there was a handful of things that I found lacking, specifically around the ease of use for non-technical staff to create and maintain campaigns. And so when we started working with our outreach team, I really felt that the IT department shouldn't have to be a gatekeeper for these campaigns. That I really wanted the staff to be able to take full control of what they were doing. And so it was important that I found a way to open the floodgates, so to speak. And so for us, that was with Luma. So it just so happened we had implemented both products around the same time. So we were launching live with both Luma and Population Health. And after we did our initial campaigns in October for cervical cancer screenings, we found it difficult. Our QI team was, they weren't struggling, but they knew it wasn't a good fit. And so we kind of went back to the drawing board, and we decided that, okay, with the ease of use of population health, and getting data out of the system, we thought that, hey, let's use Luma to create these broadcasts. And so for this year, we're generating these lists. So we're, just like you see here on the screen, we're finding the list of patients. We're looking at those measurements, the performance metrics, and we're running those reports. And then our outreach team can then quickly export the data in a Excel format and a CSV, and then upload it into Luma. And I've got some screenshots here of what we've done with Luma. And so over our implementation period, you can see here on the right-hand side of the screen that it started pretty low. So we had a bare bones messaging system that wasn't very good, to be honest. And we had about less than 24% engagement rate. And then with Luma, being that it's super flexible and it allows the patients to kind of communicate more easily and effectively. In fact, with Luma, we're able to converse with the patients via the interface. But you can see over January and February, we had a 37% engagement rate, and then it jumped up to 45%. And then now, as of the end of last month, we're up to about 60, almost 64%, which is pretty amazing. Sending out these campaigns, and you can see the spikes in messages when we've sent these out, which is kind of neat, as you can see the flood of messages going out. But I think for me, it's great to have this technology in the hands of the people who actually use it, because they can really take ownership of these projects. They can really feel invested. And I think that especially for technology initiatives in organizations, that's something that can really carry forward quite a bit.
Can you talk a little bit, Mike, about, I think you used this in a impacting perhaps no-shows with
Yes,
behavioral
and
health
so
clinics particularly?
when we launched Luma in January, we immediately noticed a 1% decrease in overall no-show rate. I think that's all specialties. So we're medical, dental, behavioral health, and we have a handful of specialty providers as well. And I think where we have seen the biggest increase is in behavioral health, where we went from double digits. Some of our providers had 20-25% no-show rates, which is now dropped down to single digits. And I don't want to seem insincere here, but our cancellation rates went up, obviously, but that's allowed for our staff to be able to fill those appointments more quickly. So yes, our no-show rate has dropped, our cancellation rate has gone up, but we're able to now more effectively fill those holes. And looking at the January numbers, we filled almost 1,000 additional appointments compared to January of 2024. So we were able to schedule almost 1,000 more appointments than we did the previous year, which is pretty amazing.
Excellent. And so what you can do with population health is identify a cohort of patients that you want to engage with. You can export that list, whether it's someone who doesn't have a metric that they, a gap in care, they need to have breast cancer screening or colorectal cancer screenings, et cetera. Or you might identify high-risk patients with a particularly high ASCVD score, right? And you generate that list of patients, and then via Luma, the patient gets to engage with that list of patients, gets to engage with Luma via the care team, so they can do their own scheduling within Luma if you have that component engaged. So that helps to let the patient be more autonomous and communicate kind of asynchronously, so to speak, with the practice versus the just not showing up because I couldn't quickly access the information about my visit.
And I think something that's organically kind of developed out of this is the need to communicate to the patients in a way that they're comfortable with. So previously in our old messaging solution, when we'd send out text messages or broadcasts, that we'd receive a response back from the patient, and we had no way of replying to them. And I think that's something that's become a cornerstone of our QI department, is really kind of making sure that all the patient's needs are addressed in that respect. And so we'll send out these broadcasts, and patients will say, hey, I'm not really sure about this, or our staff can actually go look at that message and connect back with them and say, hey, we apologize for, maybe you got added to this incorrectly, or let me clarify this with you, or the clinic's not open, or whatnot. So we're able to actually communicate with the patient, very much more efficiently now through other platforms. So this is our cervical cancer screening, which we had done in October of 2024. We had done outreach through population health. We had used letters, again, those tabling events and flyers. And so for us, we were trying to move the needle. I know we had set a goal of 5%. I believe we were able to manage about a 1% increase. Which is a win either way. A positive gain is a positive gain, but it's not what we wanted to see. So that was one of the factors in looking for other ways to outreach to the patients. And so when we decided to move to our 2025 campaigns, we again used Luma. We used recall and broadcast messages, patient education. And so I believe we're able to move the needle, a few more percent, actually meeting our measure this time. So that's a good sign. And I think one of the great things about this is we're actually able to see this. And I'm not sure how many of you folks out there are either on RPMS or using third-party off-the-shelf EMR systems, but population health gives us real-time visibility into all of our GIPR measures. And for me, that was super important, because historically it was we submit the data and then we get a dashboard back from the Indian Health Service. And that was time consuming. It took forever, and it wasn't super helpful for our providers. And so here now we're able to look at all of our measures in real time, drill down through all of our data, and act on it. And so that's been super important for us. I'm not sure, Julie, if you had any other comments about these slides here real quick.
Right. Yeah. When Mike is referring to, so that what you're looking at here is within the metrics component within the Inform platform. And so you can see this is HIV screening for GIPRA, but as we've inferred in previous, there's patient lists behind all these live links for numbers, right? So patients meeting goal, patients not meeting goal. And that's again where you can drill down and take a look at the patients that are affected by this measure and your opportunities. And so when he talks about the ability to see it real time, we have the capability of, with the next gen EHR connecting with next gen population health, to send these gaps in care to the point of care in what we call the point of care insights tool. And so that displays within your EHR record, when you open a patient, if you have population health, then you can see that this HIV screening needs to be done for this particular patient. And so you can create that visual for the care team when the patient's in front of you. So that's very valuable. You can have conversations with your patient, etc. There's also opportunities within the population health solution to do pre-visit planning, that you can help drive lists of your scheduled sessions for the day, to do huddles, to also call out opportunities to make sure that you're making the best use of time and getting the needs met when those patients come in. We know that sometimes you get only one chance, right? With some of our some of our patients, and so you want to make sure that you help to guide them in the best way, most efficiently when they're with you. And then, you know, you can do the outreach proactively, as Mike has been mentioning with Luma. There is some opportunities within Top Health to do some email, or within the EHR, excuse me, email, text messaging, et cetera, also. But there's not the reciprocal that Luma offers that I think is a good next layer. So we have all 26 GIPRA measures within the population health application. And then currently, we're getting ready to release some opportunities for the actual tribal health reporting, which will allow our tribal partners to export their reports for GIPRA to NDW, also for IDA, and be able to visualize kind of real time how your IDA measures are going, and then also the Title V immunization program. Because we know that those are all things that you folks all need to help not only take the best care of your patients and populations, but to secure funding, that's most important, and also to submit data so that IHS knows exactly what you're doing, right? And so you can then secure further resources for your populations as a whole in Indian country. So, you know, I think there's a lot of opportunity to see your whole universe, and take some actions based on your priorities, your strategies and goals. And we're always happy to help support that.
And I just want to say one more thing regarding the measures. We had implemented, you know, when we went live, we were given a handful of, well, I won't say a handful, quite a bit of measures to pick from, and so it was important for us to get all the metrics that were required, and even after go live, we've been able to really kind of flex some of those measures and report on other things. And so, you know, I've been in contact with Julie and the implementation team after the fact. And we needed to report on location. So each of our facilities is built as a separate location within our EMR, and we wanted to be able to look at these metrics based on those locations, not just as a organization on the aggregate, but each specifically, because that's also important for reporting. We're supposed to report on the different service units, and so again, I think population health is only limited to the things your team can really kind of concoct and think about, because there's so much flexibility in the data.
Excellent.
And so I've got a couple of quotes here from our staff talking about what we've done with population health. Erica Garcia, our director of quality and compliance, has been a big advocate of population health from the start. We bring our teams together to look at the big picture of the community health by combining medical, dental, behavioral health, and outreach services. We make sure our tribal members get the wraparound care they need, rooted in culture, connection, and whole person well-being. And so we've done a lot of work with our outreach team, and I think that our patients are really responding to it, which is amazing. And our CEO, Eric Lyon, kind of speaks to what I said earlier. The uses of Pop Health are limited to our creativity and willingness to try. We haven't even scratched the surface of its capabilities to help provide better care for our patients and community. So again, the flexibility of population health and being able to look at the data and really kind of slice and dice your data in a way that's useful to you is an extremely powerful tool. And then Ashley Ice, our director of wellness and outreach. Our core belief is that relationships matter. We recognize that the journey of wellness can be an overwhelming one. Through compassionate care and cultural connection, we offer holistic support. Pop Health has provided a tool for our team to stay connected to our patients and walk alongside them in their path to wellness. And I think that kind of underscores our mission with both our outreach campaigns.
Yeah, and I think like you mentioned it, back in the beginning about, we're really talking about storytelling, right? And so, we talk about the data, and I like to refer to it sometimes as the data that the patient has in their backpack, right? That patient has a story to tell, and sometimes they don't always know what they need to tell, or what they should tell, or what they can tell, and sometimes um, they don't understand the value of that information. Sometimes it's tough to talk about, right? They don't want to share that information, but it's very important to their well-being. So sometimes we can help to tell that story of what's in that patient's backpack so we can provide the best care for them, and have those conversations with them, and help to interact and bring them along in their journey towards wellness. So, we look at the believe in better, but we really truly do strive to improve healthcare outcomes, for all. And the integration of these data capabilities really helps to tell that story for the patient, for an entire population, for your communities, so that you can really streamline and target your efforts as care teams, as health centers that are really providing care for the entire community. So that's excellent, Mike.
I just have one more comment regarding that. So, I don't think I mentioned it earlier, but our initial launch for this year was healthy relationships, and along those, the metric was, HIV screening, and we had an increase to meet our measure. And that's something, a very sensitive subject that's very difficult to talk about. And I think that's kind of speaks to the value of this, is that we're able to outreach in a way that our patients would respond to. Especially for a sensitive subject, seeing an improvement on these measures is for me a giant win.
And I know you've spoken before, Mike, about how, your team on the IT side, this by incorporating these tools and these resources, Luma, population health, in collaboration and integration with the next gen EHR, you have felt that your team as an IT team is more empowered to impact outcomes, right? And that really does help drive your team's desire to do better, right? And to do more. And they feel like they're part of that direct care team.
Yeah, I think, IT departments a lot of the times only get the limelight when something's broken. And so I feel that these initiatives give your IT team a way that they can feel connected to providing patient care. And so that's super important for me as well, because my vision of the IT department is that, we're here, we don't exist in a vacuum. We're here to make sure that everyone else can do their job. And I feel that, providing uh, our care teams with tools that, can really make a difference, helps leave that impact and make sure that the IT teams, my team specifically, knows that they're doing a good job. So being able to see these improvements is a quantitative a metric where we know that we're making a difference.
Awesome. I love that. And you and all your team should celebrate that.
Thanks.
I just want to say, Julie, one of the things that you said that kind of stuck with me is when you were talking about, patients, they come and they have this backpack of things that they maybe don't know how, or what they need to share. And that just really resonated with me as someone who is unfortunately in and out of medical facilities with their child all the time. And that is what a great way to put that.
Excellent.
Really, I just wanted to take a second to hop on here, you guys. Remember, if you have any questions, please submit them now or forever hold your peace. No, I'm kidding. We have follow-up information, but I did also want to take a second to say that this is, in case you didn't already know, part 1 of a 3-part series that we are partnering with NextGen on. So the following 2, I will submit in the chat here. If you want to go ahead and register for those, you probably got an email about them as well. I also wanted to say that this webinar will be available for viewing within 48 hours. You'll get a direct link sent via Zoom. It will also live on our website. So for future viewing, if you guys want to come back and circle back to anything as well. I'm excited to get into the rest of the series too. I love that Next Gen is doing this storytelling focus for the year. I think it's a really awesome thing. So thank you, Julie. Thank you, Mike. I appreciate you guys being here.
Thank you for having us.
Yeah, absolutely. And again, make sure you check those links. You can also find the ability to register on our website, tribalhub.com. So thank you.
Thank you.